AskReddit. Doctors of Reddit, what are some of your anti-vax parent stories? I'm not a medical doctor but a mental health therapist. Went to do a new client intake, and while asking the mother about the kid's medical history, vaccination records etc., she said he was not vaccinated because vaccines cause autism and she didn't want to risk her son getting it. Then when I went to meet the kid, within 5 seconds of laying eyes on him I could tell he was autistic. Worst part was that when I told her, she became very upset and started yelling at her husband, saying he must have gotten the kid secretly vaccinated, and then immediately ran out the house and took the kid to the emergency room for testing and just left me and the dad in the living room just kind of staring at each other. Never answered my calls or texts again after that, and I had to get DCF involved. I had a kid come in that was super sick. 3 years old and in septic shock. He had the flu and another compounded viral infection, I want to say pertussis. Heart rate was close to 200, respiratory rate in the 50s, blood pressure in the 70s. Kid was so fucking dry that we could barely get IVs into him, and I almost had to drill an IO. We dumped a ton of fluids into him, started him on vasopressors and transferred him to the local children's hospital. I had asked the mom if he was vaccinated and she said no, vaccines have really bad side effects. They'll make you sick. I explained to her that not getting the vaccines had made her kid 10 times sicker than he ever would have been from any mild vaccine reaction. She told me I was a fucking moron and that I obviously have no clue what I'm talking, and that's the reason her kid was getting transferred. She also told me that recommending she vaccinate her kids was racist. For anyone not familiar with the jargon, an IO is an intraosseous line. That means the thing goes inside your bone to deliver fluids. Had a 5 or 6 years old patient who had a super hippie mom. No reason for not vaccinating other than she doesn't want to, despite counseling many times. Kid also had asthma and would consistently come in for exacerbations despite prescribing appropriate controller meds. The amount of exacerbations just didn't make sense. One day, I sent my student to see him first while I called the pharmacy to see if his meds were received. The student came back saying I can't get a history from mom. She's literally falling asleep while talking to me. Also, pharmacy said the meds haven't been picked up from the last 3 visits. That was enough for me to call CPS. Mom was on drugs. Living situation deplorable. Last I heard, kid was moved to an aunt who caught him up with age-appropriate vaccines. I'll tell a different kind of story. I am an ER doc and recently had this interaction with a patient. Adult male comes in with fever. He comes back positive for the flu. Me. You have the flu? I will write you for a prescription for Tamiflu. Patient. Doesn't that cause autism? This guy couldn't even remember that it was vaccines that reportedly cause autism, and he couldn't remember that it wasn't the flu vaccine. And of course he is wrong about vaccines causing autism, and he is a grown-ass adult that thinks he will suddenly be autistic. Not a doctor but I work IT at a hospital. I came to fix a nurse's computer in the ER and there was a woman being led out by a pack of half or dozen police officers. She was ranting and raving about how the doctors were killing her baby and she was going to sue the hospital and track down the doctors and have her boyfriend kill them. The whole 9 yards. Kid was crying in their room and was being restrained by more officers and nurses. Kid, who was like 9, calmed down after about 5 more minutes. I asked what that was about once everything calmed down, and I was told that the kid got bit by a raccoon. Animal control had captured and destroyed a raccoon that tested positive for rabies on the same street that the mother and child lived on only a day or 2 prior. Animal control was actively searching for this raccoon as well, since it had apparently just gone up to the house in broad daylight and entered the garage where the kid was playing and bit him before running away. Obviously this is an extremely high likelihood of another infected animal and the kid needed the rabies vaccine. Well, the ER doctor had made two mistakes. 1. He had not initially referred to it as a rabies vaccine but rather as a series of injections to prevent rabies from infecting the child. Most anyone would hear that and suspect vaccine, but apparently the mother had not only never heard of the rabies vaccine, but didn't initially interpret preventive injections as a vaccination either. She was told the boy would need the first injection as soon as possible, and since we had the medicine on site we could do it right away. The mother consented to the treatment and the physician made the order and went on to explain the procedure to the mother in greater detail to make sure she was properly informed, which is when he made his second mistake, which was referring to the rabies injections as the rabies vaccine. The security cameras above the nurses' stations caught the details, but the mother lost her gourd over this. She screamed at the doctor for so many things. She accused him of trying to deceive her, that she never would have agreed to the procedure if she knew it was a vaccine. She said he was trying to poison her child and give him the autism. She accused him of being a pedophile because he wanted to stick something in her boy. Finally, she accused him of being racist. All three of them are black. By this point, other nurses, in hospital security, and a few actual officers are all at the room. The kid is crying, terrified obviously. The mother wants to take her rabies-infected kid home and away from this place of nightmares. To be honest, there are a lot of crazy people in the ER, and up until this point it's all somewhat normal. That all changed when a nurse showed up with the actual rabies vaccine and needle for administration. The previously hysteric mother hit another level when she saw the needle and just straight up attacked the doctor, pounding on his head, back, and shoulders while screaming. I could hear this part all the way down the hall as I was coming to fix the computer. She wasn't even saying words anymore, just screaming. She was restrained by officers who had already called for backup and who arrived slightly before I did to escort her away. Since I work in IT and not in medicine or legal, I'm not entirely sure what the procedure from that point on was. I did follow up with the nurse a few weeks later who told me that animal control had captured and destroyed 2 more infected raccoons in the area but were not able to determine if either one was the one who bit the kid. The kid did eventually receive his vaccinations and was doing okay. I wasn't told what happened with the mother. That's my most interesting experience with anti-vax people in general. Okay, I am not a doctor but I'm pregnant, so I see one pretty regularly right now. Lol, it was time for my TDAP booster and I was asking about the MMR booster. My OB asked if we are planning to vaccinate the baby, and I told him that shouldn't even be a question he feels he needs ask any of his patients. So he told me this story about a teenage patient who came in with her mom. The mom was going on and on about how she teaches her child to live a healthy and holistic lifestyle free of drugs, vaccines, and chemicals. Well, turned out the daughter had gotten gonorrhea from her boyfriend despite her healthy and holistic lifestyle. My OB said he felt great seeing the mother's face when he delivered the news. Lol. When I was a medical student, I had a 5-year-old patient who looked and acted like a 2-year-old, failure to thrive. His mother was super weird. She shaved the sides of his head, somehow like a marine cut, but kept his back hair long. She refused to vaccinate him or even feed him certain foods. Her sister and her husband were trying to get custody of the child because his mother was weird and didn't take care of him properly. I suspect she was paranoid. She would literally fight and call you names if you attempt to suggest to put the kid on a proper hospital diet. She wanted to inspect the food first and make sure he eats only certain things. Long story short, the attending calling county and they took the child away from her. Edit. Thank you for those who pointed out that the haircut is called a mullet cut. Another point to add, he was admitted for a fracture which was really worrisome in a kid that age. Unfortunately, I don't know what happened to the kid after they took him away, but he's definitely better off, I had a mother bring her child to see me as a new patient. When I saw that he wasn't vaccinated, I asked my nurse why not, and she told me that the mother had a religious exemption. When I entered the room, I asked the mum what the religious exemption was, and she said, "Oh, well, when he was a baby he had a rash from the hepatitis B vaccine." I kindly told her that I couldn't care for her child because he was not only a risk to my staff, myself, but also to other patients in my office. She went off on me and ranted about how she cannot believe that every doctor's office that she calls refuses to treat her son because he isn't vaccinated. And that the only doctor in the county that will see him can't see him for almost 2 months. I kindly stopped her and said, if I was one of a few that refused to treat your child, I would understand your frustration. But don't you think there's a message that not a single doctor in the entire county, save for one doctor who did some really questionable practices, think essential oils and stuff, will treat your kid? That maybe there's a valid reason behind it? Yeah, she definitely wasn't happy and left. We had a 14-year-old female come in for abdominal pain one time. She weighed 80 pounds. Looked sickly. Her mother refused to let her eat anything but a handful of things, nothing with very much protein at all. She literally had a binder full of articles about how horrible vaccines are, all the bad things they put in food these days, etc. She had completely brainwashed this kid, so the kid believed it too. Her labs showed malnutrition. Her teeth were horrible. Just a sad case all around. Nearly qualified pharmacist here, so obligatory not a doctor. Our pharmacy offers travel vaccines for people going away to countries with a high likelihood of severe tropical disease. Star parenting goes to the parents who got themselves vaccinated for rabies, but not their 2 primary school age, elementary, for non-Brits, children. 4th year student reporting in. Had a rotation with a pediatrician where we ended up in the classic encounter with an anti-vaccination parent. This lady was a conspiracy theory magnet. She casually mentioned everything from 9/11 to chemtrails. Of course, she loved the idea of the vaccine conspiracy as well, opting to not protect her 1-year-old to stick it to Big Pharma. I relayed all of this to my attending after my exam. I would see the patient first, gather history and do my exam to present to my attending physician. He got this sort of lazy smirk on his face that screamed, "Watch this." We go back into the exam room and we cover all of the important bits of a well-child encounter. Growth charts, behavioral milestones, nutrition, sleep. And then we get to vaccines. She lists approximately 15 reasons why vaccines are more dangerous than the disease they protect against, lol, in addition to the various evils of the pharmaceutical industry. My attending listens quietly until she's done with her soapbox, about 1 eternity later, and then interjects with, "Have you considered the possibility that anti-vaccine propaganda could be an attempt by the Russians or the Chinese to weaken the health of the United States population?" In a moment of catastrophic cognitive dissonance, I swear I heard a strange popping noise as her brain misfired. It actually broke her. The allure of the increasingly ridiculous conspiracy theory was just too strong. She ended up agreeing to a modified vaccine schedule. I was flabbergasted. My attending just grinned at me in response. To this day I'm not sure the medical ethics of the situation are totally palatable, but goddamn, the result was amazing. Had a kid come in for generic upper respiratory virus. Asked mom if he was vaccinated, as is routine. She said no. When I asked why not, her response was, "Well, my boyfriend was vaccinated and he still got meningitis, so they don't even work." I told her that's the same as saying your friend got bruised by a seatbelt in a car accident, so you don't wear them when you drive. I was a medical student when this happened. My attending pediatrician gave me a heads up about the parent I was about to see and decided it would be best if he came into the room with me. 4-year-old kid came in with a horrible cough and difficulty breathing. It was almost sure as hell pertussis, aka whooping cough. The kid was coughing so bad he vomited on the exam table. He went on to ask about vaccinating her kid, and of course she replied no, even though her son was damn near coughing up his lung right next to her. I think my attending had seen enough and had enough of her not vaccinating her kid and had the following conversation with the kid's mom. Attending: Mrs. Anti-Vax, I have to ask you. Do you trust me with as your son's doctor? Mom: of course I do, Dr. Attending. Well, there's two problems here that we need to address. 1. You either think you are more knowledgeable than me when it comes to medicine, and if that's the case I should no longer be your son's doctor. Or you don't trust me as a physician, and in that case I shouldn't be your son's doctor. Mom: blank stare on face. Attending: will you please reconsider giving your son a vaccine? Mom: no. My attending obviously treated her kid, but after this whole ordeal resolved, he fired her and her son as a patient and referred them to another pediatrician. He had enough of her shit. I respected the hell out of him after he pulled this move. Thank you for watching all the way to the end. If you were at all entertained, please consider giving this video a like and subscribing for future content. Stay safe everyone, until next time.